posteriorly and anteriorly, and a little bit of effusion seen around the radial head. Same thing on a knee. That is the elliptical soft tissue density here, which is really fluid in the prepatellar bursa. See how beautifully you can see it on the MRI. This is again a heavily T2 weighted image, which is a fluid sensitive image. Fluid anywhere will be very, very bright, and you see a lot of fluid in and around the knee joint, and on the axial images around the behind the patella. Lipohemarthrosis, something that you see with joint trauma when due to fracture, fat from the marrow escapes into the joint cavity. There is fluid here, and there is this very bright fat floating on top of that fluid. So this is basically blood or fluid, and this is a lot of fat which is escaped from a fracture. So when you see this, you know you're dealing with an intra-articular fracture. Baker's cyst, again, fluid can accumulate anywhere in the Baker's cyst, in the bursa, behind popliteal bursa. T1 shows a low signal defect and very bright on a T2, and this is the intermediate or a proton density image, which shows you this fluid behind in the popliteal region. Bursitis, again, can be due to trauma, can be due to infective causes, can be due to inflammatory causes. There is bursitis along the deltoid tendon, and there again in the shoulder. Marrow edema, bone injury. Now this again is an interesting image, because again you see this is very black, and this is black because we suppress the fat in it. The fat is very bright on MRI. If there is, you can imagine if this was bright, you wouldn't see this. So we suppress the fat, and what we are left with is this edema. This is due to edema, bone edema, and this is what you get when you have bone injury. There may not be a fracture, but the bone is injured and it reacts by accumulating fluid in it, just like you would have edema anywhere else in the tissues. And sometimes this will help you look at the underlying cartilages and ligaments, and this will be the area where you will look more carefully. Indirect muscle injuries, you probably know these. The only way I've put this up is because you don't want to diagnose these on MRI. These are clinical decisions. You will make these decisions in your clinic, and you will not send the patient for an MRI for this. And of course, there's grading of muscle sprains, 1, 2, and 3, and of course all that. And direct muscle injuries can result in muscle contusion. Signal here, and you can see that that's what the normal signal should be, but this is completely ruptured here. There's a discontinuation right there. That's a posterior cruciate ligament. Again, it's very bulky, it's gray. The signal is almost like that of the muscle, which is not right. That should be much darker. And there you see a very high signal within this PCL, which means that this is torn. On the axis, so that's the PCL, and you see that high signal area within it. That's a partial rupture of the PCL. And there, that's a chronic this thing, and you can see that the PCL is very lax. Ligament injuries. You see again a medial collateral ligament, and that's again another medial collateral ligament, which is bulky. They can be complete muscle tears, and later on there can be hematomas, and when the hematomas progress, they can get calcified or ossified, and you get what is known as myositis ossificans. Grade 1 and 2 muscle injuries, again we will not do MRI to diagnose grade 1 or 2 muscle injuries, but this is what it would look like if incidentally you do see them. This muscle is injured, it is very white compared to the muscle over here. This is because of edema, increased fluid in there, and there again that is also normal muscle. This is abnormal signal within the muscle because of edema. And over here again in the ankle, there is increased signal here because of injury. Muscle injury grade 3.